COVID-19 is continuing to surge in parts of the United States, and many hospitals are under strain. The highly contagious Omicron variant is driving up infection numbers in some communities. Manuel Bojorquez reports from North Carolina, where medical facilities are struggling.
On its second day of operation, 900 people showed up to get COVID tests at the Charlotte theme park Tuesday.
Whenever there's an increase in cases, there's always an increase in demand for testing. You know, a lot of the other sites in the area wanted to take some of the congestion off hospitals and primary care physicians.
This site opened Monday when many were still closed due to this week's winter storm. If needed, they're prepared to up their daily testing capacity to 3,000.
We can absolutely scale up to that capacity. Right now we're running 4 testing lanes. We can easily switch that up to 7.
The latest data shows 1 in 3 people tested statewide was positive for the virus.
I think the public experience of Omicron and this surge is very different than what you see when you're in the walls of a hospital.
Dr. Katie Passaretti is chief epidemiologist for Atrium Health Carolinas Medical Center in Charlotte, where 156 COVID patients are on life support, more than 90% of them unvaccinated.
So for people who think Omicron is not that big of a deal, you're saying what you're seeing inside those hospital walls is a big deal.
Yeah, and you know, throughout the pandemic, the experience of healthcare workers taking care of the sickest of sick patients, watching young people that are unvaccinated pass away from COVID, it's incredibly heartbreaking and devastating.
All right, let's bring in Dr. Dyan Hes to talk about the latest COVID headlines. She's the founder of Gramercy Pediatrics right here in New York City. So, Dr. Hes, Americans can now order 4 free antigen tests in the mail from the government. You know, Ed sort of pointed out that they're not meant to just, when you receive them, swab your nose just to see where you are in the grand scheme of things. They're really meant for specific reasons. Can you break down what those reasons might be?
Yeah, I would say if you're going to go visit your grandmother in an old age home, you know, they might want you to be tested, things like that. So, or if you're symptomatic, if you wake up feeling with a headache, fevery, you know, chills, you should swab yourself before you go into your office. I just think 4 is just a drop in the bucket, you know, so I'm actually not a huge proponent of all this extra testing. I actually think that COVID is everywhere. I think the cat's out of the bag. So I really think you should use it on those days that you might put other people in jeopardy, that you might have to have your mask off for some reason. Like if you have a dentist appointment and you're not feeling well, swab yourself, you know, things like that. If you're going to get your hair cut where somebody's going to be in your face and you're not feeling well, swab yourself. But I just think that, you know, common sense prevails. If we're, you know, right now, because, you know, Omicron is so prevalent, if you're sick, assume that you have COVID until proven otherwise.
So, as you know, the World Health Organization's chief scientist has said that there is no evidence yet to indicate that healthy children and adolescents must get boosters. Do you find many of your 12 and older patients are seeking or looking for a 3rd dose?
So, you know, there's a big controversy about this. I think that they're looking for the boosters because a lot of schools and after schools are saying, we want you boosted to come back. And parents are really on the fence about it. I think medically speaking, these kids are probably fine with just the 2 vaccines. They might get COVID, but they're not going to end up in the hospital, which we know they're going to do fine. It'll be a more mild illness. I think the WHO has a different agenda because the WHO's agenda is to get the most vulnerable vaccinated. So they need to distribute vaccines all over the world, the 3rd world countries, you know, where the cold chain is poor, where we have to get vaccines to very, very rural areas. So their goal is to get the vaccines to everybody who really needs it first, who is going to die if they get COVID. In the United States, it's different. We have a first-tier healthcare system, and we have the luxury that you can opt to get a vaccine or not. I still recommend the booster. I can definitely tell you that both my kids got the booster. They were exposed to COVID multiple times, and they did not get COVID this time around. So, and that's what I'm seeing with my patients. But I think the WHO's agenda is slightly different because their goal is to get everybody on this planet vaccinated.
Let me ask you about this. In a study published in Nature, researchers examined 23 pregnant women, and the data suggests that a COVID infection can cause neonatal inflammation and possible long-term morbidities. How can expecting mothers best protect themselves given sort of the high level of community spread nationally?
I think that's a little bit misinterpreted. So what it showed was that there were inflammatory markers in the umbilical cord blood of the babies, but they didn't show any long-term comorbidities. Those studies have to be done for years out. And what I could tell you as a clinician is that we're not seeing any signs of any problems with babies who are exposed right now. So this is just something that's going to be long-term. But mothers, mothers who are pregnant have to wear their mask. We know that pregnancy is a mild state of immunodeficiency. I have a friend who's an anesthesiologist in Virginia, in Richmond, and she said 75% of the women who are on the OB floor, labor and delivery, are positive for COVID. I'm sure these women are wearing masks and, really being cautious. It's just Omicron is everywhere. It's very, very contagious. And that's why, this whole controversy of masks is even working, because it is so contagious. So it's just about taking care of yourself. And if you're feeling overrun, or if you're pregnant and you're not feeling well, seek a test and go to your doctor. But I don't think we should start scaring people that the babies are going to have long-term effects, because we don't know that yet. And what we're seeing is that they don't.
And let me ask you about something close to home. New York City Mayor Eric Adams reacted to the recent decline in COVID cases here in New York City. Let me play some of what he had to say.
Sure.
But New York, we have not won yet. We have more to do, as I want to continue to say that over and over again. But let's be clear on this. We are winning.
All right. Dr. Hes, from your perspective, are we winning?
Yes, I think we're also winning because the virus is changing. I think a little bit of that is luck. I think Omicron is much more contagious and much less virulent. I think New York City has done an amazing job with vaccination. But as you see in Charlotte, 92% of their patients are unvaccinated. So there are definitely states in this country where the vaccination rate is very low. And those individuals who are choosing not to get vaccinated are putting a huge burden on our healthcare system. And I just had this discussion again last night with a friend who I respect her. She doesn't want to get the booster. She's vaccinated. And, and she's just, and I said, we were just talking now. She's like, well, if Omicron's not so dangerous, why do you have to get vaccinated? And I said, because you are vaccinated. You don't see what we see. We see hundreds of thousands of people coming to the hospital very, very sick who are unvaccinated. And they're taking up all the resources of the healthcare system. People are driving who are sick from hospital to find a bed because they cannot even get admitted if they're having a heart attack. It's going back to where we were at the beginning. So yes, I am very happy, and I agree with the mayor that New York City is doing very well, but we need to do better all around the nation.
Yeah, it's a good point that you make, Dr. Hes. I mean, I think that, sometimes those of us, for example, here in New York City, we look around and we say, look, the numbers are coming down. It feels not as it perhaps might feel in some other parts of the country. But as you say, you have to be aware that there are people that are still suffering. There are still people that are finding themselves on ventilators. And so if the simplest thing you can do is just wear a mask, so that if you come into contact with somebody who's immunocompromised or who has a pre-existing condition, that you don't make them sick, that's something to keep in mind. Dr. Hes, I always love talking to you. Thank you very much.
Take care.